Welcome back to At the Heart of Health. I'm so glad you joined us. There's so many other things you probably could be watching right now, but what more important opportunity to learn about your health. We're so lucky to have Dr. Ken Scott. He's explained to us what a hospitalist is, and he's been answering some questions about acute care problems that we sometimes get. Ken, that last question on vaccines was very interesting. The next question is sort of a hospital-related question, and this question comes from a person that was recently hospitalized. This person was hospitalized in North Dakota, and they say that they have had an infection, and this infection was called MRSA, not Mrs. A, but a real infection called MRSA. The question is what is MRSA, and can I ever get rid of this infection, and is it deadly, and what should I do about it? Those are the questions that come up.
That's a very good question. MRSA stands for methicillin-resistant Staphylococcus aureus, which is a bacteria that is one of the bacteria that is plaguing modern healthcare. It is a bacteria that is important because people often pick that infection up while they're in the hospital.
So they get it from the hospital?
Well, yes, they can,
Oh, wow.
because this bacteria will actually live in the hospital. Okay. And what makes it so important, it's probably been there all the years before when we didn't know about it. And people are familiar with a staph infection. I got a staph infection. Well, it's the same bug, methicillin-resistant Staph aureus. But the problem is that since this staph bug has lived inside of hospitals and nursing homes and healthcare facilities for so long, where antibiotics are given on a regular basis, that bacteria has been exposed to a lot of different antibiotics. And because of that, it's gotten smart. And it learns how to resist antibiotics. And because of that, it becomes a very difficult infection if a patient gets it in the hospital for us to treat, because it's hard to find an antibiotic that will fight off that bacteria and kill it.
I see. So this person has this MRSA infection. What should they do? Is it going to kill them?
Well,
I assume it's not. I assume it's sort of a quiet infection that's just sort of sitting around the body.
Well, not always.
Okay.
It can be a life-threatening infection, especially in people that are already immune compromised because of illness that they have. Diabetics, people with COPD, people with congestive heart failure, these people that already have chronic illnesses, if they come in the hospital and they get an MRSA infection, it can be a very serious thing. It can be bloodborne, where the bacteria is in your bloodstream. It can cause a pneumonia. And so these are not just simple infections to get rid of. Yes, they can be treated, but part of the concern with physicians today and with medical science is this whole thing about how much antibiotics are we giving out.
Right.
Because the more we do, the more bacteria like this we create. And eventually we're worried that we will not have an antibiotic to treat it. Right now we still have some antibiotics that we can treat that infection with, and for the most part people can get cured from it at this point.
Wow. So anyone with MRSA, I guess they should make sure their provider knows that they've had this infection in the past. It might help choose antibiotics.
That would help. And also you can actually become colonized with it, where they find that bacteria on your skin, or even swab your nose and find it in your nose passages, but you're not truly infected. You're not running a fever, you're not having symptoms from it. And usually, if you can stay off of antibiotics and stay healthy long enough, those bacteria will go away. Most people have staph on their skin.
How about the ones that are resistant? Can your body get rid of those?
Yes, they can.
Okay, so it's possible this person lives healthy. It's possibly that he won't have MRSA even colonized down the road.
That's right. The other thing is about MRSA is that there's actually two categories of MRSA now. There's hospital-acquired, which is what we just talked about, and there's community-acquired MRSA. It's basically the same organism, only the exposure of that bacteria to antibiotics is a little different. And so we can tell when we test that bacteria against different antibiotics, the pattern is different, and we can tell often if it's a community-acquired bug or a hospital-acquired bug. The community-acquired bugs can actually give you serious infections as well. And again, this goes to show you how much antibiotics we're using in outpatient medicine, that staph in the community can become resistant irregardless of whether you're in a hospital or not. most of community-acquired staph infections are caused, what you get when you get that infection is a skin infection more than anything else, a cellulitis. There are ways to try to avoid that, and one thing is good hand washing is really important, not just for healthcare personnel, but for people in the community, especially in communities where you know that MRSA, community-acquired MRSA, is rampant.
You know, I have a friend that's sort of germ phobic, and he's sort of paranoid about things, and he does things, you know, I never did this, but when he goes into a hotel room, he dusts off the phone. He even goes to has a gas station, you know, the gas station where you pump your gas. He will make sure he wears gloves so he's not transmitting these bugs that might be resistant.
Right.
So it sounds like, you know, a good defense is not so. It's a reasonable thing to do.
It really is, and I actually carry hand sanitizer around with me too, and when I get my gas or whatever, I do the same thing.
Now, what if you're a politician, though? I mean, those guys should probably be sick all the time, as many hands as they shake.
Well, you know, for most people that are healthy otherwise, they're not going to get an infection like that. I mean, I treat both types of MRSA every day. In the hospital, I shake people's hands every day. I've never gotten an MRSA infection. Right. And so part of this is doing normal common sense things to keep you healthy. Another place that you will find community-acquired MRSA is on sports teams.
Oh, really?
Yeah. Wrestling teams will tend to get these cellulitic infections, the skin infections. If you exchange clothes on the sports team or pads, protective pads, you know, knee pads or whatever, you're much more likely to get a community-acquired MRSA infection, including sharing dishes, drinking out of the same glass, those type of things. Common sense things.
I think those are a lot of people aren't careful about those type of things, and that could save someone's life, especially if these bugs are becoming resistant to antibiotics. Sounds like we might be overusing antibiotics too.
It is a very big concern.
Why is that happening? Why do people use antibiotics so much?
Well, it's kind of a twofold problem. On the one hand, we have a community that wants a quick fix to everything. In America, you know, if you're hungry, go to the fast food restaurant and get it right now. And it's the same thing with our health care. We don't like to miss a day of work or a day of fun. We don't want to be sick. As soon as I've got a sore throat or an earache or a sniffle, I'm going to go and get my antibiotic right now because I don't want it to last a day longer. If you go to your doctor, you know, when I talk to my colleagues that are out there in the community practicing, well, if I don't give them something, they're not going to come back and see me because I'm a bad doctor.
Oh, I see.
And so there's a pressure on the healthcare community to give something, and there's a pressure out there of people that don't want to be sick, they can't afford to miss work, make me better now. And sometimes it ends up to be something that really, if we practiced these things that would keep us healthy, you know, getting fresh air, getting in the sunlight, washing our hands, doing those things, we'd prevent a lot of these viruses or bacteria, whatever the infection is, and our bodies would be stronger, getting enough sleep. Our bodies would be stronger enough to resist these infections, and we wouldn't need antibiotics so much.
Very interesting. Well, I hope that answered your question. Our next question is coming from the great state of Vermont. And this is actually from a caregiver that's taking care of a patient that had a hip fracture. Right. And they're asking, what are some common sense things we could do to lower the risk of having a recurrent hip fracture?
Yeah, that's a very good question because, as you know, our society is aging, and as the healthcare costs in the nation goes up, a lot of it is in hip fractures and in injuries that occur as we age. And the first thing that I would say right off the bat is to be observant. You really need to be observant of the elderly people around you, your parents or your grandparents or whatever. And the reason why is 9 times out of 10, when a hip fracture comes into the hospital and I'm taking care of them and I ask grandpa or grandma what happened, they're totally startled that this happened to them. They didn't realize that they had any problem with their balance. They didn't realize that they were going to trip or fall. It's an accident, just like we have accidents as younger people. And so they didn't expect it. And sometimes we younger family members can look at our parents or our grandparents and realize that they're getting at risk. We can see that their balance isn't as good, that maybe their eyesight isn't good. And if we're observant and can get them into a doctor to be checked sooner, we could avoid some of these problems. it's much easier to take an individual patient and design a program for them. But let me give you some generalizations that might help. To start with, an exercise and balance program to strengthen elderly people's legs and improve their balance would help in making sure that they're not falling, okay? A physical therapist can help with that, and if you take your loved one to their doctor and you can show them that they're unsteady on their feet or whatever, that can be arranged, and they can go to physical therapy for that. Another thing that happens is that their eyesight gets worse and their hearing gets worse. And so you have to think of a patient's environment at home. If you go home and rearrange the furniture, you want a different setup, it's Christmas time, you're going to move this here and put the tree there or whatever, what's going to happen is at night when there's not sunlight coming in the windows and the lights are dim, Grandpa is not going to see the changes, and he's going to tend to trip over a chair that's out of place or the coffee table that's been moved or whatever, and then we've got a problem.
These are great suggestions, and we're all out of time here now, but we'll be back next week on At the Heart of Health. Hi, I'm Dr. James Marcum with your Daily Heartbeat. I have a saying I like to say, and it's this: it's at the heart of healing is love. Now, what would that mean, and what would that have to be with healing? But did you know that love is a way that we can change our body's chemistry? There's been studies done that show people that have animals, which could include a dog or a cat, if they have them, they actually have less heart attacks, less stroke, less infectious diseases, and even less malignancy. Well, do you think it's anything about these animals yelping and barking and meowing that changes the chemistry? No, it's not. It's the love that's shown between owner and manual. Likewise, we know that people that are happily married, if one of the spouse should suddenly die or get sick, that there's a greater likelihood of the other spouse developing a disease. So at the heart of healing is love. And love is one of the most valuable treatments we have to stay healthy.